Welcome to Diversity in Practice, working with LGBTQIA+ children and young people. I'm Emma Nugent, Information Sharing Project Officer at the Centre for Excellence in Child and Family Welfare, and I use she, her pronouns. Before we begin today, I'd like to make an acknowledgement of country. We would like to acknowledge that we are all joining you today from Aboriginal land. For me, I'm joining you from Wurundjeri land of the Kulin Nation. We pay our respects to Aboriginal and Torres Strait Islander people and acknowledge elders past, present and emerging, and extend this respect to any Aboriginal and Torres Strait Islander people here with us today. We acknowledge that sovereignty was never ceded, and this always was and always will be Aboriginal land. The Diversity in Practice webinar series has been developed by the Centre for Excellence in Child and Family Welfare and will explore what good practice looks like when engaging with children and young people from diverse backgrounds and communities. This webinar series is supported by the Department of Families, Fairness and Housing and Family Safety Victoria under the Marram Sector Capacity Building project. The Marram framework highlights that children are victim survivors in their own right, with their own unique experiences of family violence, including specific threats, risks, protective factors and risk management approaches. Marram emphasises that all interventions must consider the impacts on each and every victim survivor, including children and young people. This webinar series aims to explore what this means in practice for our work with children and young people from diverse backgrounds and communities. As such, Marram also uses an intersectional lens throughout its tools and practice guidance as a core part of risk assessment. It is important that professionals understand how intersecting factors such as identity, systemic oppression, structural inequality, and discrimination can impact upon the way a child or young person interacts with the service system. Today's session will focus on the topic of working with LGBTQIA+ children and young people. Research shows that children and young people who identify as LGBTQIA+ may be more at risk of experiencing family violence and child wellbeing issues due to negative attitudes, beliefs, and discrimination. As such, it is important that professionals are aware of how to safely engage and support children and young people who identify as LGBTQIA+. The intersection experiences and identities that these children and young people may face are important to understanding the context of their experience of family violence, whether from family of origin or family of choice. This will also help inform how professionals can support children and young people in seeking safe, inclusive, and appropriate family violence support. Our speakers today will present on this topic, and then we'll have a chance to have a facilitated discussion. Please note that while the question and answer box will remain open for the duration of the webinar, we'll be taking questions on notice. It is important to note that today's discussion will highlight the successes, challenges, and learnings that each speaker has encountered in their work with LGBTQIA+ children and young people. What will be presented to you today is still a work in progress, and while we don't promise to bring you easy answers or solutions, what we will bring is an open conversation, where audience members and presenters alike can reflect on their practice and work together to create better outcomes for LGBTQIA+ children and young people. Before we begin, I'd like to introduce our speakers today. Jeffress is one of the clinical team leaders at Berry Street in the Take Two Restoring Childhood team. Ellen is a social worker and family therapist. Ellen has worked in the family violence sector in Melbourne's North for 10 years and has worked with children and young people who have experienced trauma for over 15 years. Ellen uses they, them pronouns. Larissa Fogden is a clinician in the Take Two Restoring Childhood team. As a social worker, Larissa has worked with children, young people, and families across Melbourne in a range of specialist family violence and sexual assault services in crisis, refuge, justice, and therapeutic settings. Larissa was previously a high school teacher in New South Wales. Larissa uses she, her pronouns. Before I pass to our speakers today, just a few notes on housekeeping. Audience members' microphones and cameras will remain off by default for the duration of today's session. And just a reminder that today's session is being recorded. There is a content warning for our discussion today, so please ensure you reach out for professional support if this raises any issues. You'll find these resources with numbers and websites in the chat. I will now pass to Ellen and Larissa for the presentation today. I'm looking forward to it myself. Thank you, Ellen and Larissa.
Thanks, Emma. Thanks for having us along, and welcome to everyone from wherever you're coming from today. Larissa and I are coming from Wurundjeri lands, so we also want to pay our respects to Wurundjeri elders, and we also want to acknowledge all the lands that you might be coming from today and acknowledge these elders. We acknowledge the nurturing Aboriginal folks have for their land. I'm just getting my head around the slide, so things might be a tad delayed, but I'll work it out. We thought it might be useful to think about where Larissa and I are coming from today, and maybe talk a little bit about our program. We were thinking it might be useful to understand our point of view as we talk to, I guess, our work and our ideas, so that you can locate where these are coming from. So we both work for Berry Street, and we work in an amazing program called Restoring Childhood. And Restoring Childhood is a specialist family violence service, and we support children 0 to 17 and their victim survivor caregivers. We are part of Take Two, which is a trauma-informed service. And I guess today we're thinking about a bit about intersectionality. And so Take Two, I guess, thinks about trauma for infants, children and young people, but also thinks about child development. I guess a part of Take Two is thinking about the systems that children live within, so attachment systems, parent-child relationships, but also cultural systems and community systems. We are also privileged to work alongside our colleagues who are part of the Northern Specialist Family Violence Service. And so that's a broader family violence service, providing a range of responses, partnerships with the police and courts, and child protection, and crisis response, case management. So we try to draw upon, I guess, parts of Take Two that we're under, and also the Northern Specialist Family Violence System. We work in the northern part of Melbourne and the Central Highlands, and we also have some colleagues out in the Mallee. We're Rainbow Tick accredited, like so many specialist family violence services, and I guess we're trying to continue that thinking. We're thinking about supporting LGBTQIA+ folks. We're part of a consortium, and we've got a range of amazing partners. We've got In Touch, helping us think about culturally and linguistically diverse folks. We have Rubik's, helping us think about people with disabilities. And we also have Thorn Harbour Health, and they used to be called the Vic AIDS Council, and helping us think around LGBTQIA+ folks. And I guess that partnership has really been influential in our work in this area. I guess one thing to say is that we're a specialist family violence service. You know, we're not a specialist LGBTQIA+ service. This is a priority, and we're doing work in this area, but there are specialist services around, like Thorn Harbour Health and Drummond Street. I guess typically our work, it is relational work, so we see parents and children together. We do some individual work with children, but it's very much in a systemic context, and we also do some group work as well. So we might think about today a bit more. So today we're focusing on a few areas. We're thinking about the importance of creating safety, and we're going to think about why that's important for this particular population group. Clearly safety is important for everyone, but LGBTQIA+ folks have some specific needs and experiences. We're going to think about the barriers, so what gets in the way of engagement, but also really what gets in the way of safety. And then we're going to look at some practice examples of what safe and effective engagement looks like. As you can tell, I'm still very much getting my head around the Zoom webinar. But these are the three things that we'll be looking at today. So what we really want to thank folks for coming along and doing this thinking with us. As Emma has pointed out, you know, just look after yourself. I'll do the same. I've got a cup of tea. I'm coming out of a cold, so I'll be drinking some of that. But just do what you need to do to look after yourself during this time, and we'll trust that you'll do that. We're coming from a clinician perspective, and so I guess we're really aware that people work in lots of different service mandates, different training, different disciplines that people come from. So we're coming from a clinician point of view, therapy and counselling, and I guess our language and some of our ideas are very much located in that. And so we totally get that you'll need to translate things into your own context. As Emma mentioned, I use they, them pronouns, and Larissa and I are part of the queer community and obviously doing this work professionally, but we can't speak for everyone. You know, we're not all the L's, the G's, the B's, the T's, the Q's, the I's, the pluses. So, you know, we've got our point of view personally and professionally, but this idea of intersectionality, that there are many voices and many experiences, and we want to be allies within our community to make space for other voices as well. So we're going to talk to our work a bit and try to really centre the voices of children and young people at the same time. We do have some tip sheets and some resources, and we've mentioned intersectionality a few times, so you'll get a copy of some of the frameworks that we're talking about. So, for example, the one Everyone Matters with Family Safety Victoria. The queer community, there are changes and evolutions in lots of ways, in symbols, in language, and many folks would be familiar with this flag. I guess one of the first iterations of the rainbow flag, but over time this has changed, and there's hopefully this trajectory to being more inclusive, but also more intersectional. So this flag here has includes trans folks, includes people of colour, and then the third flag here includes intersex folks. So I guess there is this change in language. I know for some folks it can feel a bit tricky because things change, and today we're using LGBTQIA+, but over time that might change as well, and so that's really normal. We do think that part of safety is trying to get your head around different terms. So I think it'd be useful for the less common terms like intersex. It's really normal for people to have variations of chromosomes and hormones and sex organs, and maybe pansexual, where folks are attracted to people regardless of their gender and maybe attracted to folks across the gender spectrum. And maybe getting your head around the difference between sex and gender. You know, today we're thinking about gender as more around identity, sex is more around hormones and chromosomes and sex organs. But I think, you know, we also understand that to centre the voices of intersex and trans folks around how they might use those terms, and things do change. We're not about having to get everything right, but about taking accountability and getting a head around the language. There's so much we could say about the experience of queer folks, and you know, when I was born, it was homosexuality was a criminal offence, and so there's a lot we could think about this. And in the early 90s, it wasn't until then that it came out of the World Health Organization as a mental illness. There's a real I guess, traumatic experience here, and thinking about that as being part of the collective legacies. but there's also a collective legacy of resistance and solidarity and advocating for rights. I think part of safety is knowing our history. So if you're not aware of the history, we can point that out to you. It can feel very historical at times, but there's such a present day context of this, and that there's still so much work to do. This year in Melbourne, neo-Nazis protests with a sign saying "Destroy pedo freaks," and that idea of queer people being compared to pedophiles runs really deep in our community. We've been, labelled as perverts and deviants, and so just pointing that out, it's a bit confronting in some ways, but just to say that this still goes on. There's still a real lack of gender affirming treatment, long wait lists, and just, I guess, a reminder that marriage equality is not the end of the story. There's still so much going on. Oh, I can see in the chat that somebody's saying it's hard to hear. I'm just going to check my microphone volume, but maybe I'll talk up a bit. Thanks, folks, for pointing that out. Okay, great. Thanks, folks, in the chat. That's useful to know. I will try and talk up a bit. There's a thumbs up coming up. So there is this phrase that we use in our program. It's not what's wrong with you, it's what's happened to you. And we've borrowed this from the child-parent psychotherapy model. So it's a model where we support younger children, so infants and children, 0 to 5, and their caregivers. And this statement, I think, is becoming so much a part of our program, where we think about the context of people's lives. One of the tip sheets was developed by Y Ballarat, and there's this term they used in that, which is go beyond the surface level. So we're using this iceberg metaphor, and Y Ballarat is a group of young people, lived experience young people. So they co-developed one of the resources. So as they say, let's go beyond the surface level and think about what's going on for folks. So beyond the surface level, I guess, and we're sort of thinking beyond what's written on your referral is heteronormativity. So this idea that the world is really set up for and by straight folks, and queer folks are finding our way and making space for ourselves. That, I guess, translates to homophobia, biphobia, transphobia, and intersexism. So there is a range of violence and harassment and bullying from young folks. It could be within families, but it also could be within the community as well, in schools, in workplaces. A lack of representation. So there's a real theme of, queer folks not always seeing themselves in the world around them. Intersex folks experiencing non-consensual surgery, children experiencing that as well. And for trans and gender diverse folks, a lack of gender affirmation. Threats of being outed is such a common experience for folks in the community. And we're thinking about more covert experiences. So just the world that's set up in a heteronormative way. It's not always violence and sort of explicit violence, but it's might be just binary language or the exclusion of something. So not seeing yourself in your workplace or not being visibility. So that's below the surface. These are more the things that you're likely to see on your referrals. So mental health, like anxiety and depression, self-harm and suicide. I'm just going to put them all up because I'm looking at the wrong screen. That's better. So disengaging from education, and there's some great resources around the impacts of what's beneath the surface on how folks engage in education, impacts on the parent-child relationships, and behaviour modification for safety. So what you see on the referral and why people come to your service, there's a bigger story to that, and that's the point of this. And we're going to kind of come back to this metaphor throughout our presentation. I'm going to hand over to Larissa in a moment. I'm going to skip this slide just for time's sake.
Hello, so Emma and Alan introduced me just before, but my name's Larissa, and Alan and I are just so pleased to have been invited to do this presentation today. We're really glad to have everyone here as well. So from here, we'll learn a bit more about what we do actually know about children and young people in the LGBTQIA plus community, which unfortunately is just not enough. It's not a huge amount at all. We do know a bit about adults, as this is where most of the research has been done. And we've got reports like the La Trobe University's Writing Themselves In range of reports that they've done over a period of time. And we really have these reports to thank for what we know about young people in the community. We've linked, you'll see this report linked throughout this presentation, and we've also placed it in the resources on our tip sheet that we'll be sending out later on. But we don't have enough research or understanding about children's experiences. And this is really a bit of an issue because we know that children are recognising their sexual orientations and gender identities earlier than previous generations. And it's no longer such a rare thing to disclose or to come out before you're a teenager these days. So we just can't really assume that a child is too young to be thinking about these things, because they might have already started exploring issues related to their sexuality, their gender identity, their intersex status, and they've probably already begun to internalise discriminatory attitudes about a range of these identities. So as we start to discuss what we do know about the experiences of young people, it's also important to be keeping in mind what younger children might be experiencing too, because those difficulties aren't just going to come on board once they turn 13 and become a teenager, but, you know, are probably starting to emerge earlier on too. So most of us here will be well aware that a huge number of LGBTQIA plus young people experience poorer mental health and wellbeing outcomes, and that's compared to their cisgender, heterosexual and endosex peers. If we go back to the iceberg metaphor that Alan brought up earlier, these are some of the signs and symptoms that we tend to see when young people are referred to our service. And the stats can be pretty hard to sit with. So on the whole, LGBTQIA plus young people are significantly more likely to be diagnosed with anxiety and depression, experience high and very high levels of psychological distress, engage in self-harm, attempt suicide, disengage from school, and experience homelessness. And this isn't because of a person's identity. So it isn't because a person is intersex or because they have a particular sexual orientation or gender identity, but it's those experiences of associated stigma and discrimination, and then the culmination of these experiences of transphobia, abuse, and other actions of exclusion and prejudice that directly affect young people's mental health, which is all of that underneath of the iceberg. So stats from the Writing Themselves In For report give us a bit more of an indication of the scale of these issues for LGBTQIA plus young people. So while just over 1 in 5 young people in the general population experience high or very high levels of psychological distress, which is already a pretty big number, we've got just over 4 in 5 LGBTQIA plus young people aged 16 to 17 are experiencing those high to very high levels of psychological distress. 2 in 3 LGBTQIA plus young people have reported feeling unsafe or uncomfortable in secondary school. and 1 in 4 have attempted suicide. And 2 in 5 have experienced harassment, verbal harassment, in the last 12 months based on their gender or their sexuality. And below these difficulties, there are a range of experiences that are directly impacting the health and well-being of young folks. So this is a list that's specific to trans and gender diverse young people, but it also gives us an idea of what else might be going on in the lives of queer young folks. The Royal Commission brought about this real emphasis on children as victim survivors in their own right. And another big area of attention that the Royal Commission recognised is that young people who are same gender attracted and gender diverse are particularly vulnerable to experiencing violence and abuse within the home, often related, but not always related, to homophobic and transphobic attitudes from family members. And this has led to these broader service system reforms that many of us would be familiar with if we're working within the sector. So including a dedicated MARAM section assessing risk for LGBTQIA plus people, and also assessing risk for children and young people, which is something that didn't really exist in the craft before. And also further funding for support services that are now specifically being funded to address the needs of these particular groups. But we do still have a way to go. So if we're thinking about experiences of LGBTQIA plus children and young people in the context of family violence, it can be difficult for queer young folks to recognise that what they're experiencing is family violence, because there can be the expectation within the community that rejection and other bad reactions when you come out to your family is just normal and kind of to be expected. LGBTQIA plus young people, particularly those age 15 plus, still face barriers in accessing services for family violence, particularly if home becomes an unsafe place for them to live. So young people can often get lost in the system where, particularly over 15, they might be seen as too old for child protection, but too young for family violence services or government housing, private rentals. And that's then further complicated when we've got accommodation options like traditional family violence refuges, which are gendered, for female victim survivors. And trans and gender diverse and young people don't know which services are necessarily going to address their needs or allow them to enter their service, or even which ones are just going to be safe. After separation, parents can also continue to use the family law court processes to further control and abuse LGBTQIA plus children and young people. So for example, if it's agreed in a parenting order that a father needs to consent for any medical or counselling services for the child, if they're not affirming of the child's identity, they might prevent their child from exploring their gender identity with a psychologist or their GP. So this is just, I guess, a very small insight into some of the complexities of working in this space. And I guess there is no one experience of family violence, and many intersecting factors can come together to create a unique experience. And we also need to be open to the idea that LGBTQIA plus children and young people might also experience violence in the home that's unrelated to their identities. And like with all children, they'll be impacted by family violence, even if it isn't directly targeted at them or they don't see or hear the violence. But it will be discrimination and stigma that's related to their identities that will then intersect to create a unique experience of violence and also barriers to services. But there's also another part of the story here too, and this can have, I guess, really important impacts for all groups, even when family violence is in the picture. So the research is unanimous that when children and young people are supported in their relationships, in their identity, we typically see an improvement in mental health. And family acceptance has been shown to have a significantly positive impact on mental health and well-being, but so too has acceptance from friends, peers. Ooh, sorry, I'm just having slide issues for a sec. Give me 1 second. All good. So acceptance from friends, peers, families of choice, connection to LGBTQIA plus community as well, having safe and supportive adults outside of the family, whether that's workers or teachers. And all of these protective factors indicate that what we need to be doing as workers is helping to strengthen young people's relationships. Other protective factors that we can harness include representation, so seeing other queer folks around in society, or engaging in opportunities for activism and advocacy, like going to protests or engaging online with the queer community. And having access to environments and structures that are safe and inclusive, like safe schools, safe workplaces, and inclusive healthcare too. And young people can face a range of barriers in trying to access healthcare and other services that are safe and inclusive. And Alan, I'll pass back to you. Alan will have a look at some of these barriers in more detail.
I was just thinking about our language, Larissa, and that I don't know if I flagged this earlier, but we're using the term queer community a lot, and I know for some folks that doesn't always fit. It's something I think that young people often use. So just acknowledging that. And so I guess it's a bit of a reclaimed term, queer, but if you're working with parents or older folks, it may not always fit for them. So coming back to the iceberg metaphor, and I guess where I started and then where Larissa took us was thinking about experience and presentation, or experience and functioning, what people go through in terms of homophobia and transphobia, and how that translates to their mental health and how they're going at school. We're sort of moving into this idea of barriers, so what gets in the way, and that term, what's beneath the surface, we're going to use this metaphor. So all of that, all those experiences we're talking about translates to a mistrust in services. And Larissa and I were talking about this as being quite protective. I wouldn't see it as a negative thing as such, but you know, queer folks are just sussing us out really. And we use a term called earning the right in our program. So it being up to services to really earn the right and demonstrate trust, and that really being a starting point. We've spoken about this a few times. One of the barriers, you know, is not seeing yourself in the world around you, and there can be some really demonizing social messaging, and this can translate to folks thinking there's something wrong with them, so not seeing themselves as entitled for support. There's many layers to that. Risk of information being shared or being outed, so you know, hearing stories about how services might go, and knowing that context. So I think that's a really familiar one. And lots of young people and children come in the context of their parents giving consent. And so they're probably thinking about how you're going to engage with their parent as well. They may not be aware of the support services available. They may not be aware that we're doing all this thinking about being inclusive. We know that there is a group of people that prefer specialist services, but as Larissa was pointing out before, that there is still, it's just under 50% that prefer mainstream services, but to be inclusive, which is the bit there. They want mainstream services to be more inclusive. And rejection from caregivers, as I was pointing out, people often come to support in family systems. And so thinking about that might be a barrier of how that might play out. And an inaccessibility. So there's lots of barriers, I guess, around whether there's other intersections for people, that gender, sex and sexuality, but maybe disability, geographic location, a range of things. Specialist services having long wait lists, and especially gender affirming healthcare. And a lack of community knowledge. So when people do get through to us, are we equipped to respond? I'm just going to have a sip again. I feel a bit of coughing coming on. So we're going to try and think about some frameworks, and part of this is thinking about how to orient to this work. I actually think it's a big ask sometimes for practitioners because there's such invisibility in this area for queer folks, but also for practitioners. One of the things I've used to orient to the work is thinking about my values. And some of these are Berry Street values, but some of them are more personal values. And so I'm going to think about a case example and to think about how these values reconciled with my work and at times didn't reconcile. And I guess in our team, the idea of having reflective space is really important, and later on we'll talk about reflective practice. So we're going to think about my work with Malachi, and this is a de-identified case study. So the barrier here we're thinking about is a fear of getting it wrong. And why we've thought about including this barrier is there's lots of systemic barriers we could think about today, but we're going to focus on us as practitioners, just I guess because that's in our sphere of influence, but we're not making the assumption that everything is in your influence. There's some things that are absolutely more systemic and we all need to take responsibility for. But the fear of getting it wrong seems something so familiar, something I've experienced myself and heard my colleagues talk about as well. So this is Malachi. Malachi was 16 when he came to the service, and Malachi was referred due to school disengagement. Like all the young people in our service had experienced family violence, had seen their mum assaulted, and they'd been assaulted also. Presented with high levels of dissociation, outside of sessions, more in the home, was quite emotionally dysregulated and also experienced sleeping difficulties. So this was a little while ago now, but my approach was really what I would have called at the time client-led. That I didn't want to insert too much of my own stuff. And so I just tried to follow Malachi's lead. I had a real sense that gender or something along those lines was important. And as the months went on in our work together, had this sense, but really wasn't quite sure how to respond. And what ended up happening was I actually became quite immobilized by that, and it resulted in quite a lot of inaction. I eventually asked Malachi as the sessions were ending, and unsurprisingly, gender was something that they were working through. We attended to it, I guess, in the way that we could during the closure, but it really didn't feel adequate enough. And I was like, I knew something was going on here and I just didn't know how to bring it in. And that fear of getting it wrong really got in the way. What did I learn from this? It may not feel like a sort of a huge issue, you know, but for me it was because it's something I'd picked up on. I knew it was important. And what I sort of thought about this, and what happened in this client-led approach was the burden was on Malachi to speak the unspeakable. And that's another thing that we've borrowed from our child-parent psychotherapy model, is it's really up to practitioners to speak the unspeakable at times. I was really worried about projecting my own stuff. So I was working through some gender stuff and I was worried about that getting in the way. And what I've realized now, that there's some real patterns for me. So when there's a fear of getting it wrong, you could have lots of responses. You know, there's a range of things you could do, but for me, it's probably getting a bit immobilized, not knowing what to do. And coming back to that values framework, I realized that I was trying to be really respectful and kind by following Malachi's lead, but it actually lacked courage, because courage, I guess, is the bit of being able to speak the unspeakable. And the bit about humility it lacked is being able to live with getting it wrong. And I can see that during this time with Malachi, I wasn't actually prepared to get it wrong. And given that I was not prepared to get it wrong, it really got in the way. So I sort of had to think in how to reconcile these values. I feel more okay to live with getting it wrong, that idea, when there's accountability, because it can feel so dismissive, if you make a mistake, that's fine, move on. But it's not that type of thing. It's more that you take responsibility. And so I thought about that a bit more. And what I ended up doing was writing down a framework for relational repair, because I thought if I'm going to take some more risks, I'm going to need to know how to repair the relationship. And I had found that at times relational repair gets talked about in really quite dismissive ways. So I thought, well, what would I want to do? And so the first thing was managing my defences. So we work in a trauma-informed service, and there's lots of language around this. There's zones of regulation. So you might think about being in the green zone or window of tolerance. You might think, being in a regulated position. And so it's this idea that you've got your thinking brain on board. So getting into that space, then briefly speaking to intention. So I was thinking, if I had said something that was offensive to Malachi, I would talk about, it wasn't my intention to hurt you. But then I wouldn't stay there, because I've sort of experienced that when people stay in intention, it kind of centers them. So to center the young person, I'd center Malachi by really trying to acknowledge the impact of what I had said on them. And then move to accountability to kind of say something like, this is important for me and I'm going to do better next time. And so it's just my version of how I would cope if things did go pear-shaped. You'll need to think about what you get stuck on. We're all different, so this is just my bit. Larissa, I think I'm going to hand back to you, and you're going to think about safe spaces.
Yes, I am. So thinking back to some of those barriers to service engagement that Alan spoke about earlier, which might be internal or they might be systemic, there are a range of practices that we can undertake that can help us to reduce or remove at least some of these barriers and assist in making LGBTQIA+ young people feel safer, respected, and supported. So Alan has just highlighted the importance of relational safety when working with kids and young people, which is one part of providing an inclusive and culturally safe service. But it's also important to think about what messages your service is sending from its initial engagement with a child or young person. Because LGBTQIA+ young people will suss out a service from the moment that they walk in. So providing a visibly welcoming environment can send the message to children and young people that they're welcome within the space. So this might be doing things like putting up posters of flags and other images, including pronouns on name tags. So we've got ours here. Providing access to gender-neutral bathrooms, or if that's not possible, having a sign that makes it really clear to young people that they're welcome to use whichever bathroom they like. But services need to be aware that having these visual cues, and if you are interested in learning more about visual cues, I'd really highly recommend having a look through some of the Rainbow Tick accreditation documentation, because they've got great ideas about how to increase those cues. But if you are going to be putting these visual signifiers around, it sets the expectation for young people that staff will be knowledgeable and respectful in their interactions with young people. So there needs to be follow through from all parts of the service, because young people have talked a lot about their frustration with having to then, approaching a service thinking, okay, this might be all right, and then having to use their limited time with workers to educate them, or, be asked a whole range of invasive questions that don't really seem like they're related to the service provision. And avoiding making assumptions based on name or appearance, because it isn't obvious from looking at someone that they're part of the community. And young people often won't come out or disclose until they feel safe to do so. So if assumptions are then made and mistakes aren't responded to in the moment, by workers or by reception staff or by anyone associated with a service, then word will spread within the community that this is not a safe place for you. Allowing flexibility on forms too, so including a box or a space on forms for young people to self-describe their gender identity or sexual orientation, rather than making them choose between a set of options and fit themselves into particular predefined boxes. Letting young people know too that their names and pronouns can be updated and changed whenever they like within those files. And it's also really important to respond to the presenting problem that young people are coming to your service with. It's not always going to be that being part of the LGBTIQA plus community is the presenting problem, but it could be experiences and risks stemming from family of origin, family of choice, intimate partner violence, or not being aware that what they're experiencing is a form of family violence. So recognizing that other aspects of their life may or may not intersect with one another, but recognizing how, I guess, gender identity, sexual orientation, and intersex status are going to impact the overall experience. And building safety into your service, it takes time and it is an ongoing process, and it's not something that, Berry Street are doing perfectly at all. But it's also about recognizing that adopting one set of behaviors and language that applies to all LGBTQIA plus children and young people isn't the answer, but instead it's about being open and curious and responding to and valuing the needs and perspectives and experiences of the specific child or young person that you're working with in that moment. And in Australia, there's a growing list of programs and resources that can help you build a safe space for LGBTQIA plus people. You might find the following resources helpful, and we're also going to send out some ideas and resources on the tip sheet. So we're now just going to switch gears to share some of our practice experience with what it is we actually do in the room with children and young people and their caregivers. So in our service, we work where possible with children and young people and their parents together, which can be tricky business. And sometimes it's not safe to do that. But part of this work involves simultaneously holding in mind both the parent and the child perspectives and allowing both to feel safe and heard, particularly in the context of family violence. And a big part of this when working with LGBTQIA plus children and young people is exploring with the child or young person about how they want their information to be shared. Because we can't make assumptions that a child or young person's parents or families are aware or supportive of the child or young person's identity. And part of feeling safe means that children and young people need to understand that they get to choose whether they want to disclose information about themselves, and also for them to understand what's going to happen with that information, who it's going to be shared with, how it's going to be recorded. And Alan, we'll go back to you to share with us some of their thoughts on working with children and young people.
Thanks, Larissa. So I'm just going to go to the next slide. There we are. So I guess we're going to think a bit more about practice and start with young people, and then Larissa will talk about the work with parents. So thinking about this work, using the term emerging practice principles, because it's not like this is an official practice guide in restoring childhood. It's something that we're working on and developing. And Larissa and I guess, have thought about our work. We also spoke to some clinicians to put this together, but it's very much an emerging practice area. We're going to think about some dialogue, so some things that you might say and connect those to practice principles. And we've, I guess, talking a lot about using pronouns to introduce yourself. Folks will need to work out if that's safe enough to do so. So these are all ideas, but you'll work out, there'll be queer folks listening to this and allies, and you'll need to make your own decisions in your own context of what works. So let's look at some practice principles we've been thinking about. So safety through setting the tone. So the example I spoke about with Malachi, this is something I did not do. And so this one seems pretty straightforward, but it's actually quite powerful. Hi, I'm Alan. I use they, them pronouns. So it's a pretty simple thing to introduce yourself. It feels safe to do so, but it really puts things on the table from the beginning. So the next one is safety through visibility. So this is, I spoke to Monique about this example. So Monique is one of the team leaders in Restoring Childhood. And Monique gave this example of being in one of our counselling rooms with a young person. So they're in the room and those posters that Larissa was talking about before was on the wall. And the young person walked over to the poster and Monique said this, do you know what those flags mean? And the young person replied, this is the pansexual flag. I like that one. And it opened up this conversation about this young person's sexuality. I like this example because it's very much about visibility and curiosity. So leaning into what people bring. I think sometimes it can feel like we need to do all these gymnastics with engagement, but often it is just seeing what people bring with them. And then Monique followed it and lent into it, and there was a much bigger story. So in some ways, it was a moment that was a port of entry into a bigger conversation. So safety by avoiding assumptions. This one came from one of our clinicians, Chad. Again, it can feel really simple, straightforward stuff, but really effective. So the young person says to Chad, I've got a crush on someone at school. Chad says, that's exciting, what's their name? The young person says, it's Alex, she's a girl, I'm bi, you know. And so I think leaving space in the conversation, because Chad could have said, what's his name? It probably seems quite small, but avoiding assumptions, let people and young people direct the conversation. So there's safety through understanding and managing information. And Larissa was pointing this out before, and this is, I think, really important for young people. Thank you for telling me you're pansexual. Do others know this about you? I've only told my best friend. I'm not sure I want my mum to know. And I think establishing who knows what is really important. It's not to be in an interrogating way, because that won't be safe, but in a way of partnering with young people. I think it really sends a message that there are risks at times, and being able to keep those risks visible is a way of building safety. So allowing children and young people to set the agenda. And Larissa was pointing this out before, but a young person might say, I actually feel good about being gay. I'm more worried about my dad finding out where I live. I think it's really tricky for me not to think about gender and sexuality being the most pressing issue. You know, it sort of could be one of my projections, but it's really following the lead of young people. It might be a timing issue, they're not ready to talk about it, but it may not be. It actually might be something they feel really supported in, and there's something else that is why they've come to see you. The next principle we're thinking about is it doesn't need to be definitive. So keeping language that might be a bit more open. A young person might say, I'm not sure if I'm gay. And the practitioner can say, you don't have to decide. Some people decide over time, and others might feel different at various times. So the next one we've thought about is linking functioning to tough times. And this is really the iceberg metaphor, is looking beneath the surface. And I think this really has changed so much of my practice. It offers something so rich and contextual. The young person might say, I feel like my head's going to explode when I walk into school. And then a practitioner can say, You've told me a few of the teachers insist on using your dead name. Other trans folks have told me that this makes their mental health worse. I think young people are up against it because there's, I sort of used that term before, the neo-Nazi sign, which said, destroy pedo freaks. That is something that is in many iterations in our society, that there's something wrong with being queer, there's something wrong with being trans. It gets internalized, and there's internal narrative like, it's my fault. And so linking the functioning to tough times is sort of saying, hey, there's a bigger story to this. So it's very much a therapeutic intervention. So engender hope by affirming identity. So this is sort of flipping it to a positive. When trans folks can be more who they are, their mental health typically improves. And Larissa was talking about that before with those stats. I think it is finding a way to bring that into the relationship with people and finding a way to name that, and also with young people and parents. So one of the things we've realised is really useful is to credit survival strategies. And Alan Wade and Vicky Reynolds have written about this. And it's a premise that when people experience trauma or oppression, they always survive every time they try to survive. And it can look like lots of things. It can be sometimes overlooked, but there's always a story of survival. And so it's our job when we're thinking about LGBTQIA young people to really lean into that story. So questions like, what do you do to keep safe? That might be a tricky one for young people. It might be hard to for them to articulate it. So you might do it for them. You might be watching and listening to the way that they've resisted and the way that they've survived. And I think it's really useful to point that out. It can sometimes feel like to young people that they might be passive, but pointing out their story of resistance can be really therapeutic. So our last practice principle for working with children is thinking about eliciting strengths and resources. In trauma work, we can really go to deficit, we can go to tough times, oppression, and that's not the full story. There's a story of survival, there's a story of hope and celebration, and we need to find a way to attend to that. And I think with strengths and resources and celebrating young people, you might need to think when that happens. If it happens when you don't know the tough story, it could come across as dismissive. I'm not saying that every time, but you are often leaning into what's happened, linking functioning to experience, and then coming to strengths and resources is often makes it more possible. So you might ask questions like, who is most supportive? And this is not looking for perfection here sometimes. Who is most supportive? When are you able to celebrate, or most able to celebrate who you are? Asking questions like, when do you feel most confident and good about yourself? And I think really leaning into these, like, these are questions, but they're sort of ports of entry where you're trying to open up stories. And so if somebody does talk about when they feel good about themselves, I'd be asking, what are you doing? Are there other people there with you? What are they saying? And we often think about head stories, our thoughts, our heart storytellers, which are feelings, and our body storytellers. So building up a rich picture of what happens for people when they are celebrated. And then thinking about, are there queer people they admire? They might follow them on social media. There might be people they know. But we was talking before about a lack of representation, so trying to push back against that and think about who are the queer people they can admire. Some of the things that we're doing with young people, but just some of our ideas. So I'm going to hand back to Larissa, who's going to think more about working with parents.
So thinking about some of the practice principles for working with parents and caregivers, you'll notice there's a lot of similarities in what we do with parents and caregivers compared with what we do with children and young people. And part of our work with parents of LGBTQIA plus children and young people should really involve establishing a mandate for talking about gender, sex, and sexuality. So in my work, I would do this from the get-go by normalizing the importance of correct pronoun use. So for example, by introducing myself. So hi, I'm Larissa, and I use she, her pronouns. And even though it's becoming commonplace, some parents and caregivers might still not be so familiar with the idea of pronouns. And for those who are familiar, it can signify safety to them too, that this is a service that understands what their child might be experiencing. And helping parents to understand why we ask questions about sexuality and gender and want to understand what's going on for their child is also part of our work. And I've had some caregivers say to me things like, but their dad didn't know about that, or they never came out to their dad, so it wasn't an issue at home. But parents might not think that it's so necessary to the service we provide, but it actually opens doors to discussions about what it might have been like for that young person to be hiding who they are when they go home, or living with the fear that dad might find out. So asking questions like, making statements like, understanding your child's sexuality and gender will help us understand their experience and how we can support them. And then I might ask something like, is it okay if I ask you some questions about your child's sexuality and gender identity? Because this question can give me lots of insight into what it's like at home for the child or young person. Because if it isn't okay for me to ask those questions, that tells me a lot about what the child or young person's experience might be like. And that will then further guide my approach with parents. And engendering hope is another big part of our work, both with parents and with children, both in the context of healing from family violence, but also with LGBTQIA plus young people. So saying something like, we know that affirming a child or young person's sex, gender, sexuality, and pronouns promotes their safety and well-being. Because parents might feel so much fear and worry, and also when living with violence, parents also often sit with so much guilt, and letting them know that there is hope and that there are these protective factors that we can harness, and that these protective factors are in their relationship with their child can be hugely hopeful. And it also helps to establish the mandate for why we want to understand children's experiences and all parts of their experience, because we don't just want parents to accept their children because it's the right thing to do, or because they have to, or because they feel pressured to, but we do want them to understand that parental support can make a world of difference to young people's mental health and well-being. And understanding and normalizing a parent's worries without problematizing the child or young person. And this links back to holding both parent and child perspectives in mind simultaneously, even when you don't necessarily agree with the parent. And I've worked with several parents who have struggled to accept their children or young people, and obviously as a queer staff member as well, have been privy to some, really personally, I guess, affecting statements from parents. And that's something that Alan will pick up on a little bit later. But rather than trying to persuade unaccepting and unsupportive parents, which can then lead to them shutting down or disengaging, it can actually be much more effective to help parents recognise and hold in mind what's influencing their reactions, because it might be informed by cultural, faith, or religious perspectives or other experiences. And if we're also thinking about in the context of violence, unaccepting attitudes can stem from fear. And that's that fear that their child will be subject to further violence or become the target of the violence, and that their child needs to hide who they are in order to keep them safe. But we also need to help unaccepting parents better understand their child's experience, because hesitation in accepting young people's identity often arises from a lack of understanding or not really knowing what their child is going through. So going back to that iceberg, we're trying to help parents link their child's behaviours with their experiences and help them understand that it isn't their child's identity itself that's the issue, but it's the way that society responds to these identities. So rather than saying, How does your child being non-binary make them anxious? You could ask something more like, how does your child's experience of being bullied about being non-binary impact their experience of anxiety? Or it sounds like you're saying that their self-harming behaviours increase when people insist on using their dead name. And we're also trying to help parents understand what's impacting their own behaviour and responses. So what experiences have they had? And what have they learnt about queer folks that might be influencing the response to their child? And this is particularly important when working with parents whose unaccepting views are informed by their culture or their religion. How can they find ways to hold both their child's experience and their beliefs at once? And becoming aware of what's shaping these views is the first step. So saying something like, lots of parents worry about the challenges LGBTIQA plus children and young people face. What were you taught about queer folks growing up? Centering the caregiver-child relationship, because strengthening relationships after violence needs to be central to any family violence work where possible, because this relationship remains under constant attack from the violence and coercive control tactics employed by people who use violence. And similarly, what we know about the protective impact of supportive relationships for young people, it makes sense that we keep the parent-child relationship central to our work. So giving parents the time and the space to reflect on the current state of their relationships with their children and what they want things to be like by asking questions like, do you and your child talk about gender and sexuality? If things were more like whatever the parent's goal might be, what would be happening in your relationship with your child? And does your child know that this is how you want things to be? And providing opportunities to build the parent's reflective capacity by cultivating curiosity about their child's experiences. So things like, if your child was here, how would they describe their worries or their problems or goals, or strengths or hopes? Or what do you think it's been like for your child to feel like they've had to hide who they are? Because stress or discrimination experienced by LGBTQIA plus young people may not be shared by their families and therefore be potentially harder for parents to recognise and understand. And I have found it really powerful in my work with parents that when they're describing something that their child has said or done, to just say simply, what do you think that was like for them? Or what do you think was going on for them? And cultivating that curiosity also allows parents to practice holding both their experience and their child's experience simultaneously, which is just like we're doing as workers. So if we're trying to encourage parents to better understand themselves so as to understand their child's experiences, we also need to be willing to do this work ourselves, which Alan will tell us more about now. Back to you.
Thanks, Larissa. So we're going to think a little bit about ourselves. If I can get the slide to work, there we are. So this is a quote from the fabulous Chad in our team, and we did speak to a few folks sort of preparing for today. And Chad said this to Larissa and I, conveying an acceptance of ourselves supports others to do the same. And Chad was, talking about the work that they've done in this area and sort of thinking about unconscious bias and all the things we need to get our head around. I think it's a lovely quote because it creates a mandate for us to do this. It creates a mandate for us to think about our own gender and sex and sexuality for queer folks, but also for allies. So, and it's this idea that young people pick up on how comfortable we are with this area. So we use a reflective practice in our team quite a bit, and we do it fortnightly, and we do it on a range of things, and we have done it on some of this area as well. I'm going to sort of give some examples of some of the questions we've asked ourselves in reflective practice, and some of them we haven't, some of them we've just added to. But we're aware that not everyone has access to reflective practice. So just maybe thinking about the idea of a reflective practice as a space to think about what's gone on. It's a time when it can be done collectively. It's about learning together, sharing and considering perspectives, and often looking back at what's happened and planning for the future. You could probably bring those principles into supervision, or you could also do self-directed reflective practice. Sorry, I'm just going to have a drink of water. Such a pesky cough.
You're doing so well.
That has had to come at this time. Unbelievable. Okay. Oh, there's a love heart. Thank you for having put that on the screen. That's solidarity. That is what it's all about, isn't it? Thank you. I'll take that. Okay. I'm going to put them all up because I've managed to put the number these the other way around. So these are some of the questions that we've asked ourselves. So I guess we're thinking about safety today, but thinking about what frameworks you might have to promote safety. And I was talking about a framework of values, so sort of using that to guide things, a framework for relational repair to guide things, but there's also the MARAM as well. And I guess we sort of have these emerging practice principles, but I think you do need something to orient to the work. Otherwise, I think it can be really understandably difficult for practitioners. So I would think about this, like what are the things that are going to shape your work, and what do you go back to find the pathway back to safety? How do I honour the complexity in people's lives? I think intersectionality is not just about being, you know, a kind practitioner. It's holding the many stories, and it's actually a way of safety. The next one's a big question. What's being evoked for me? What patterns do I notice about myself? I think this is a really useful question to ask. You might work out which space you ask this in. You know, maybe it is something you do as in the collective team, or maybe it's something you do more personally, and you'll work out what fits for you. But I think part of the answer is understanding this. Like when we think about gender and sexuality, we're not talking about just for queer folks, for all folks, for allies as well, is what gets brought up for you. And I think understanding the pattern. So what are you drawn to? Are you drawn to more leaning into the story of the parent? Or are you quite different, where you might lean into the story of the young person and actually feel a bit punitive towards the adult? I guess I spoke about my pattern of being quite immobilized at times. So we're all different, but just get a sense of what your pattern is in this area. I think having a framework for relational repair would be really useful, and maybe having a go at writing that down. And think about your values, like I spoke about mine, but what are your values, and how do you hold those together? And how do you notice that you might lean to some values, but it's harder to hold the other ones present in the work? I think we've both, Larissa and I, have spoken about this around locating gender in a healthcare context, or gender and sexuality. I think this shifts so much because we take it out of this sort of moral conversation. And I think ideology is part of this discussion, but there are times where putting it into another framework can be just so much more helpful. And I've really learnt this from partnering with Thorn Harbour Health, is to put it in a healthcare context. I won't read all of them. And you'll have your own questions. These are just some of ours. You'll work out your own. So we're just about to finish up. And we were thinking about this idea that systemic is safer. It's young people will decide how safe it is. But this idea of looking beneath the surface, thinking about what's going on for people, it creates a mandate for the work, which is everything we were just talking about then. We're really up for time, and I want to hand back to Emma in just a sec, but this is kind of the premise of what we've been talking about so far, is that when we think systemically, it takes us to these practice principles, and we've found this to be a safer way of working with LGBTQI young people and their caregivers. I'm going to hand back. I might just go to Emma, because I can see the time goes so quickly. So Emma, if you're around, I'll welcome you back.
All good. Thank you so much, Alan and Larissa, for your presentation. I think you presented such useful and valuable insights on what practitioners can do when working with this population, but as well as what they can do to reflect on their own practice more broadly too. So thank you so much for that conversation. I thought that was really, really valuable. And I hope that everyone can take away something from today's presentation too. Well, now move on to some questions. Just being conscious of time, we might do one or two. We did have a few lined up, but just a reminder that while the question and answer box will remain open, we'll be taking questions on notice and be developing a question and answer sheet in our post-webinar information pack. So if you do have any questions, please feel free to enter them into the question and answer box, and we can answer them at a later date for you all. Just looking at our facilitation questions, we do have a couple of big ones in here, so I might choose one for each of you today. Starting with Alan, what are some common misconceptions about LGBTQIA plus children and young people, and how can professionals challenge these in their work?
Unmute myself. Thanks, Emma. I think one of them can be that mental health is a consequence of sexuality and gender, rather than thinking it as a consequence of heteronormativity. So I think, and I think we probably made that point already with the iceberg metaphor, but just being tuned into, often people think mental health is part of being queer, which it's not. I think the other one can be, you know, that LGBTQIA plus children are just like everyone else. Like, why do they really need their own support? If we support people, you know, in good ways, that should be okay to treat everyone the same. And hopefully we're making the case that treating everyone the same doesn't really work because experiences are different, and it's experiences which shape their needs around safety and barriers to engagement. Yeah, gosh, there's so many. I think the other one is sometimes we can make assumptions around how queer people look and only really sort of tailor inclusive practice to people who look queer and young people who look queer, but not to do that because I guess queer people comes in all shades of the rainbow. So just to kind of think about always trying to be inclusive. I think maybe another misconception might be if we talk about sex and gender and sexuality, it puts it on children's minds. And what we know is that kids are already working through this stuff, but often they get left with it. And the invisibility is kind of, you know, makes it so tricky. And maybe this is the last one, maybe there's so many more, but that it can be seen as just a phase. I think there is something about the age and stage of adolescence that feeds into that as well. Like, you know, it's just a time of phases in adolescence. But I would sort of think it more of it as a stage of exploration. And then for some folks, it is actually that gender and sexuality is more fluid. So I wouldn't use the word it's a phase, but people do explore, and that's normal in adolescence. But words like phases are no good because they've been used against us in so many different ways. Yeah.
Amazing. Thank you so much for that answer. There's a lot of great points you gave in that, and I hope that everyone watching today can take at least some of those points that you've reflected on then and reflect on them in their own practice too. Larissa, I might pass on to you with a question. Where do you see gaps in collaboration across the service system when supporting LGBTQIA plus children or young people? And how can these be addressed? A big one.
Yeah, this is a huge question. I'm not going to be able to do it properly justice. But I think that, you know, the family violence service system has come a long way in the past few years, particularly, but we are still pretty siloed, and victim survivors still may have to access several services for the support that they need. And, you know, just by nature of moving between services, important information about names and pronouns and who this can be shared with and kind of all of that nuance can just get lost, and children and young people can still kind of get lost. And while we are quickly moving towards having general family violence services that are trained to respond to people from a range of diverse identities and backgrounds and experiences, and also, you know, be a bit of a one-stop shop where you go and get all of the services that you need. I think there's still the fear, as we've spoken about today, the fear of getting it wrong or feeling like, you know, you need to have this specialist knowledge that you don't necessarily have, which means that LGBTQIA plus people might then be referred on to pretty under-resourced LGBTQIA plus support services, even if that's not the issue that the person is approaching the service about. And I guess I think more broadly, there's still a bit of an attitudinal shift that's occurring and within the works within family violence services, which is, if we think of the history of the family violence service movement, we have a number of women, particularly who work really, really, really hard to get to the place where we are now to have these services up and running, and expanding that service provision and upskilling workers in understanding how to work with people from the queer community who don't fit in with that typical male perpetrator, female victim survivor. That can really feel for workers like they're being asked to move on from that focus on men's violence against women and children, when obviously there's still so much more work to do in that space. So I think one way that we address it as a team, which we're very privileged to be able to do, is in partnership with Thorn Harbour Health, so an LGBTIQA plus controlled service. And it's something that, you know, we're able to speak to them for secondary consultations, and we're able to have them in for reflective practice so that our staff can continue to learn and know where to go if we have questions. So I guess at the very least, each service knowing where they can go if they do have those questions. It may not be through a formal partnership, but at least just understanding what resources are available to them.
Absolutely. Thank you so much for your answer. And I think it's such a multi-layered way to respond to things, especially from a collaboration and coordinated point of view, that you have to do it from both a systemic and organizational point of view, but also have to get it on practice level, but also not rely on just practitioners to have these odd connections here and there with other practitioners and services. It has to be something that comes both from top down and bottom up as well, be able to see that collaboration and coordination happen across the whole service system. So thank you so much for your questions, Larissa. I think we might finish up there and start wrapping up. We did have a couple more questions, but perhaps we can answer those through our question and answer sheet along with the questions we received from all our attendees today. Thank you so much for joining us for our third webinar of the Diversity in Practice series. We'll follow up in the coming days with an information pack with resources from the webinar for your reference. So those that both Alan and Larissa mentioned, as well as the question and answer sheet that we'll be developing as well. We do have one other webinar coming up in June as part of the series. So that is Understanding Intersectionality. It's happening at the end of June, so a bit of time for you guys to wait for that, but I promise it'll be worth it. It's with AIMS Australia, and a link to register to this will be found in the chat. After this webinar, a survey will also appear at the end of the session. So if you could please complete this short survey to let us know your thoughts in today's webinar, that would be greatly appreciated. Thank you again to Alan and Larissa for your presentation today. I hope you feel better, Alan, soon and get rid of that pesky cough. But we also want to thank all our audience members today for attending the webinar, and we'll look forward to seeing you at the next one.
Thanks, Emma. Thank you so much for having us.
Thank you, Emma.
Thanks for everyone for attending.